I have the pleasure to introduce my colleague Kathelijne Bessems. She is also working at Maastricht University as a senior researcher and lecturer, and will talk with us about how does the European region deal with the dynamics in school health promotion. So, Kathelijne, over to you.
Thank you for the introduction, Prof. Welcome, everybody. It's nice that you are all attending this webinar. My name is Kathelijne Bessems. I work at the same department as Nina and Stef. And I'll be talking to you in the next 10 minutes about some of the findings of a project we conducted last year for the SHE network. And that's the Schools for Health in Europe Network Foundation. So we received an operating grant from the European Union's health program to do this specific task. And in this project, we aim to get insight into the extent into which the SHE member countries implemented school health promotion and the formal health promoting school approach. Further, we wanted to get insight in the way in which the SHE member countries balanced on the spectrum Nina has been talking about a few minutes ago. And we wanted to get insight in the perceived barriers and facilitators of the implementation of the health promoting school in the SHE member countries. But before we continue, I would like to briefly explain to you how we define school health promotion for this task. So Nina has nicely introduced the health promoting school approach, but school health promotion relates to various activities, health promotion activities in schools, such as physical activity in a curriculum or a school policy. And this does not need to imply that the school has a systematic plan according to the principles of the formal health promoting school approach. So it can also be just standalone activities. And then the health promoting school approach, that's what Nina has been talking about, refers to schools that do implement a structured and systematic plan. And this then relates to the health and well-being and development of social capital of all pupils and teaching and non-teaching staff. And this is then characterized by this whole school approach. Active involvement of pupils and staff and parents is very important in this one. So I think the main difference between both approaches is that the first is then not so systematic. It doesn't have to be systematic like the second one. Second one is integrated. It's a system approach. And these are the main important differences. So within the SHE network, each country has a national coordinator. So Nina has been talking about what can you do? Well, I think that's what she was referring to was the field of health promotion. For example, the national coordinators, but also maybe coordinators at a local level, health promotion professionals. And in the SHE member countries, there are national coordinators. Some have some regional coordinators. And we conducted a survey among all these health promotion coordinators. And we did that last year in September and October. So it's good to keep in mind when you interpret my findings that these do not reflect the interpretation from the schools itself, but the interpretations from the national coordinators. And of course, they did use a lot of national data to support this if these were available. So we had 24 out of 40 countries participating in the study. And here you can see the diversity of countries that participated from, for example, Azerbaijan to Wales to Sweden and Italy. So it's quite a diverse group that participated. So first, the national coordinators estimated the percentage of schools involved in school health promotion within these countries. And the numbers in the graphs in red indicate the number of countries, just to help you understand what I'm showing you here. And the colors in the graph, as you can see in the blue circle, represent the percentages of schools working on school health promotion within these countries. The light green is then the lower percentage and dark green is the higher percentage. Overall, we can see that in 9 to 15 countries, depending on the school type, all schools implement health-related activities. So that's quite positive, I think. When we look at the school type, it shows that this is the highest in primary schools, followed by the secondary schools, and it's a bit lower in the vocational schools. In the next figure, then we can see that school types that are formally working according to the health promoting school approach. So that was what Nina was also talking about, the systematic approach. And what we can see here is that in 2 to 5 countries, all schools work according to the health promoting school approach. So this number is substantially lower than health promoting activities, as shown above. And the number of schools in which less than a quarter of the schools works according to the health promoting school approach is 8 in preschools and goes up to 11 in vocational schools. I think overall this implies that the systematic and integrated health promoting school approach is less common than school health promotion in general. And that might not be a very surprising finding, though it's still an important confirmation, I think. So our second aim was to get insight into the way the schools in the SHE member countries balance all these health promoting spectra, like Nina introduced previously. And for this, again, we asked each coordinator how schools in general scored on these 7 spectra within their specific country. And of course, this is a simplification of reality, as there will be differences between schools, within regions, within the country, but it does show us some general trends within the countries, I think. So in the next slides, I've added the mean scores of the countries as well as the range, and that's then the highest and the lowest score that national coordinators ticked off. For example, for the first spectrum, grown from top down to bottom up, it's indicated in orange here. It shows us that some of the countries, mainly top-down approaches are used, indicated by the 2 in the range, while in other countries, mainly bottom-up approaches are applied, indicated by the 9.3 in the range. And then there's the 5.1 that indicates the mean score of the 24 countries. So what are the results now? Overall, in the SHE member countries, there is a trend towards adopting multiple components, indicated by the 6.3. Non-disruptive approaches, indicated by the 4.4. Add-in approaches, indicated by the 5.7. And finally, the action-oriented research, indicated by the 6.1. The mean score of spectrum 1, 3, and 7 is around 5. And again, this is at group level, of course. So overall, both top-down and bottom-up approaches were applied. Both existing and new interventions were used in schools. And school health promotion was disseminated both locally and nationally. And as said, there will be still huge differences between the countries. And you can see this in the range. So finally, I would like to share some of the facilitators and barriers indicated by the national coordinators about the situations in schools in their countries. So these seem to take place at different levels. So I've clustered them in 3 categories, and these include factors at national level, factors within the schools, and factors that relate to the support from, for example, health promoters. At a national level, existing collaborations between health and education sectors were very much facilitating in the countries, as well as the supporting infrastructures such as health promotion, the health promoting school being part of national policies. While at the same time, lack of funding, lack of fund coordination, and lacking definitions of best practices really inhibited the implementation of school health promotion within these countries. Within the schools, at the school level then, the support of the school management was important, as well as the motivation of teachers and a common interest in the topic, while limited time, high workload, and additional activities were considered to be hindering for school health promotion. And also bottom-up approaches were active, such as by actively involving students and other stakeholders using participatory approaches, were frequently mentioned by, as supporting, while competing projects really hindered implementation. And then finally, on the one hand, training and support of school coordinators were supporting, as well as the exchange of good practices between schools and other stakeholders. And on the other hand, then lack of local support inhibited implementation. So overall, I think these findings reflect that the national coordinators experience factors such as support, best practices, fundings, and that they were not only needed within the schools and at local level, but also at governmental level. So all these levels were important and needed to be addressed. So to conclude, there are some huge differences between and within the countries and the way they implement both school health promotion and the health promoting school approach. And although we aim for an integrated formal health promoting school approach, support for both the school health promotion activities and the health promoting school approach is important. We believe that school health promotion may serve as a catalyst for stimulating schools and countries to evolve to a health promoting school approach. Sometimes schools or countries may not just be ready for the health promoting school approach yet, but later on they will be. And then systematically targeting the combination of relevant barriers and facilitators at multiple levels is likely to enhance implementation. But of course, this really requires time and continuous efforts. So if you're interested in the country-specific results, we've prepared some country-specific reports for this. You can have a look at these reports, which can be found at the SHE website. And of course, we also prepared a short overall summary. Yeah. So thank you for this.